Good afternoon. We are delighted to welcome you to this seminar organized in honor of the Commonwealth Day. Before we get started, I just want to let you know that this event is available in French.
Pour les francophones, vous pouvez avoir accès au service d'interprétation sur Zoom en sélectionnant la chaîne Français, en cliquant sur l'icône en forme de globe sur votre fenêtre Zoom.
This webinar was pre-recorded, but if you have a question, please use the Q&A feature in Zoom to ask a question, and the ALMA team will answer live. My name is Dr. Elizabeth Chizema, and I'm the EMC officer. Today's webinar is organized by the ALMA Scorecard Hub. The ALMA Scorecard Hub was launched in 2021 by the ALMA Chair, His Excellency President Uhuru Kenyatta, President of Kenya. The ALMA Scorecard was designed to support countries with the institutionalization of data use in decision-making. Today's webinar, we will host a panel discussion about the elimination of malaria in the Commonwealth. You may recall that in April 2018, 53 leaders of Commonwealth countries pledged to halve malaria by 2023. 4 years on, we are discussing the progress made by African countries, including the use of data for action, the launch of End Malaria Councils across Africa to mobilize additional resources for elimination, and the incredible efforts made by Ministries of Health to maintain focus on malaria during the pandemic. You will hear about how Rwandans continue to reduce malaria mortality and morbidity, even when faced with the disruptions due to COVID-19. We will also watch a short video about how Rwanda is using innovation such as drones and the scorecard management tool to accelerate the fight against malaria. It is now my great pleasure to invite our special ambassador, Her Excellency Professor Sheila to give us our opening remarks. Professor Sheila, thank you.
Thank you, our great moderator, Dr. Elizabeth Chichema. And we look forward to having our distinguished panel that will tell us about eliminating malaria in the Commonwealth. Now, in 2018, Commonwealth leaders took an historic decision to commit to having malaria by 2023 at the London Commonwealth Heads of Government meeting, CHOGM. Twice postponed due to the COVID-19 pandemic, the CHOGM summit is now due to be held in Kigali in June 2022, and we look forward to that. The theme for the meeting is delivering a common future, connecting, innovating, transforming. We know that the COVID-19 pandemic has disrupted malaria services, leading to a marked increase in cases and deaths. In fact, according to the latest WHO World Malaria Report, there were about 241 million malaria cases and 627,000 malaria deaths worldwide in 2020. This represents about 14 million more cases and, in fact, 69,000 more deaths than when we compare to 2019. Approximately 2/3 of these additional deaths were linked to disruptions in the provision of malaria prevention, diagnosis, treatment, and other services, especially during the pandemic. The situation, however, could have been far worse, in that WHO had predicted that with severe service disruptions, malaria deaths in sub-Saharan Africa could potentially double in 2020. Many countries did take that urgent action to shore up the malaria programs, averting this really horrible worst-case scenario. At ALMA, we are working on supporting countries to keep the fight against malaria a priority in our national development agendas. Our chair, our very noble chair that we are proud of, His Excellency President Uhuru Kenyatta, during his tenure, drove a 4-point continental agenda that includes digitalization and real-time data, including through the use of and sharing of scorecard management tools to improve access to malaria data for informed policy and action. And malaria councils and funds to mobilize additional domestic, public, and private resources and engagement of local country leaders across all sectors. Also, a youth army to champion political and resource commitments to support malaria control and elimination, and increased engagement of regional economic communities coordination to drive progress at the regional level and to achieve high impact at country level. Defeating malaria is predicated on forging partnerships to promote advocacy, action, resource mobilization, and accountability. This requires high-level political commitment where leaders commit to action, communities take ownership, sector ministries act, and the private sector becomes more responsive and partners support. Colleagues, allow me to conclude by stating that this year is critical as we work towards Global Fund's 7th replenishment, and countries work to mobilize additional domestic resources, empower communities to act, and accelerate the deployment of new malaria commodities and interventions. Commonwealth countries took an extraordinary commitment in 2018 to halve malaria by 2023, in just 2 years. So summits like CHOGM offer a unique opportunity to galvanize renewed progress and accelerate progress against malaria and to push for elimination of NTDs, helping to prevent unnecessary deaths and suffering. By bringing together government, private sector, and multi-sector leaders from across the Commonwealth and beyond, leaders can set the agenda for the global fight to strengthen health systems and to prepare countries to respond to future pandemic outbreaks. With these short remarks, I welcome you to this great event on eliminating malaria in the Commonwealth. I thank you for your attention.
Thank you so much, Professor Sheila. It is now my great honor to introduce our honorable panel. Welcome to our esteemed panelists. I would like first to introduce Dr. Ruth Katumuri, Senior Director for the Economic, Youth and Sustainable Development Directorate at the Commonwealth Secretariat. Ruth Katumuri leads on the Commonwealth Secretariat strategy and programs pertaining to sustainable and inclusive development involving advocacy, technical assistance, knowledge sharing, and capacity building for member countries. As a visionary and thought leader, working with premier international institutions across public, private, and third sectors, Dr. Katumuri has been responsible for establishing innovative initiatives and set new trends as an academic in leadership development programs through her evidence-based research and policy impact at the highest level. Dr. Katumuri, welcome and thank you for joining us. My first question for you, Dr. Katumuri. Last year, you launched a new tracker to help Commonwealth countries monitor progress towards the commitment to halve malaria cases by 2023. What is the tracker currently showing, and are we on track?
Thank you, Dr. Elizabeth. This is a very important question, and as you're aware, the Commonwealth is actively involved in addressing malaria issues. And as you'll be aware, all our work is mandated by Commonwealth ministers. In the case of malaria, we convene a health ministers meeting every year, and this was mandated by the health ministers in 2018 and setting the mission of halving malaria cases by 2023. The leaders were motivated to make this commitment because of the severe challenge this preventable and treated disease poses for health security of over 2 billion citizens of the Commonwealth. It's sad that the malaria burden continues to persist even now. The Commonwealth comprises of a third of the global population, but has more than half of the malaria deaths and cases recorded every year. 9 out of 10 Commonwealth citizens live in a malaria endemic country. Therefore, to realize the goal of halving malaria cases by 2030, the Commonwealth Secretariat, in collaboration with Malaria No More, launched the Commonwealth Malaria Tracker in 2021 to help Commonwealth countries monitor progress toward halving malaria cases by 2023 in order to attain the goals of ending the disease by 2030. These are done through targets that are being monitored towards 2023 are based on two indicators. Firstly, tracking to reduce malaria incidence by 50% by 2023, and secondly, tracking to reduce malaria mortality rates by 50% by 2023. The malaria tracker is found to be very useful because it presents an interactive visual display of the progress across all Commonwealth countries towards this commitment. And as we know, evidence-based analysis is extremely important in us understanding the situation, analyzing it, and using that to determine our policies and measures and practices and plans toward addressing issues. So in this case, tracking is very important, and tracker provides the opportunity for that. In addition, the tracker also shows information about the measures that countries have taken, as well as sharing best practices and thereby assisting in directing targeted malaria control initiatives. The message still remains, the message even now, and more so now, is that urgent action is needed by Commonwealth leaders to regain momentum in fighting malaria towards halving malaria cases by 2023.
Thank you very much, Dr. Katumori. Dr. Katumori, as the world continues to recover from the pandemic, why is investing in malaria important to strengthen health systems?
As we have been in the COVID crisis, we have lost momentum on some of these essential aspects of tackling malaria issues. It has to be noted that malaria programs serve as a foundation for better and more widespread outbreak detection and rapid response. The past 2 decades of the malaria fight have created and strengthened health infrastructure expertise and country capacities that have been effectively leveraged to respond even to the COVID pandemic in many countries. As such, recovery from COVID-19 can be bolstered through malaria investments, and here are a few examples. Firstly, strengthening surveillance systems for malaria can also boost critical infrastructure for early detection and response to emerging pandemics and for building resilient health systems toward a journey to pandemic recovery. Investing in additional resources for the malaria community engagement models can also serve as a foundation for enhanced community involvement in pandemic management, and thus community approaches are key towards the journey of recovery. Critical investments in a robust malaria health workforce will also support vaccine distribution, which is vital to ending this pandemic and closing gaps in other routine immunization programs. Investment in procurement and supply chain systems for malaria will also go a long way to protecting health programs from potential disruption during the COVID-19 recovery. This means that adequate investment is needed to ensure malaria programs can continue uninterrupted by securing adequate supplies of malaria commodities and addressing increased cost due to COVID-19 disruptions to global supply chains. Further, strengthening laboratory systems in countries, including investments in building human resources, infrastructure, and laboratory commodities, will also expand those countries' capacities for rapid detection, diagnosis, and treatment of all fever causing illnesses whether malaria or an emerging disease threat. We must utilize this opportunity to build on the investments to create strong, resilient health systems that can realize the vision of a malaria-free future as well as prevent other pandemics. Malaria investments will provide us with an opportunity to address the threat that weak health systems pose to not only populations they serve, but also to our entire interconnected world.
We are also delighted to be joined on our panel today by Dr. Aimable Bituyumuremi, Division Manager of Malaria and Other Parasitic Diseases at the Ministry of Health in Rwanda. Dr. Aimable is a medical doctor with a master's degree in health informatics. He has worked for more than 7 years in the HIV/AIDS, STI, and viral hepatitis B and C program at the Ministry of Health of Rwanda, devoting most of his time to program design and their implementation at national level. Dr. Aimable is currently the head of the National Malaria Control Program, Other Parasitic Diseases, and Neglected Tropical Diseases Division within the Rwanda Biomedical Center, Ministry of Health in Rwanda, since 2016. He is widely involved in the design and implementation of the national strategy and guidelines for malaria and neglected tropical diseases control at all levels. Dr. Aimable, the COVID-19 pandemic causes severe disruptions to malaria services, but Rwanda recently published data showing you had managed to continue to reduce malaria mortality and morbidity in the country. What did you do, and what can other countries learn from this success?
Well, COVID pandemic, the first case was recorded in Rwanda in March 2020. And because of the existing national strategies and how also the health sector is built from central level to community level, this helped really the country address the impact of COVID pandemic on services because, for example, malaria case management is done at community level and at health facility level. When we imposed like lockdown, people were able to move from their house to the neighboring community health workers to get services. At least there was no delay in getting services. This is mainly due to the existing capacity in diagnosis and treatment. This for malaria case management. But of course, even if there was a restriction, there was a clear guidance from the government that for essential services, you can move from your house to get essential services. And there was no really high impact on malaria services. For mass campaign, we were planning to distribute net countrywide in 2020. And fortunately, we had already procured them. And we were just waiting for the physical inspection. And we had, of course, to get support from the high level to get cleared so that we can continue our essential services. And because the distribution is done by community health workers, once again, this was really helpful for the program to sustain or to continue the campaign as per the plan. Of course, we made some changes on the design because initially we used to distribute net through site-based distribution, whereby health centers are calling communities to come and get net. But for this time, because there was a restriction of mass gathering, we had to redesign the strategies and ensure that for this time, community health workers are the one to go to the health centers, get net, and distribute in collaboration with local leaders using door-to-door approach. In this aspect, we were able to continue our national distribution campaign as per the plan, of course with the increased budget that was not initially planned. With the support from Global Fund, we were able to cover that additional small budget. This for prevention using bed net, and the mass campaign was completed in June 2020, and it was during the first cases of COVID in Rwanda. For IRS, it's almost the same. We are using local capacities, whereby community health workers in those targeted districts. Currently, we are spraying 12 districts. We had trained community health workers to spray, and it was very easy to continue using them during COVID pandemic to ensure that at least we don't stop our life savings interventions. I think these are just kind of showing how the existing systems help the country address COVID pandemic challenges. But in any case, community health workers were very key, and the strong coordination from high level, having clear communication from central level to district was very key, because sometimes you had to work with the Ministry of Health to get clearance for transport companies transporting community health workers, transporting net, so that they get cleared. Of course, clearance for the transport need national police, local leaders, because for other activities it was not allowed. But for this time, convincing that we need to continue implementing these activities needed a kind of justifying why we need to implement this, and getting clearance was very easy. In summary, existing systems, strong coordination from all levels, and cross-sector collaboration were very key to ensure that we address the potential impact of COVID pandemic. Back to you.
We are also honored to be joined by Dr. Joel Marceline Ateba, Chief of the Regional Unit at the National Malaria Control Program at the Ministry of Health in Cameroon. Dr. Ateba, Cameroon is one of the countries with the highest burden of malaria and is leading the implementation of the high burden, high impact approach. One of the key pillars of this strategy is to reignite progress in the fight against malaria through improved coordination and multi-sectoral engagement. What have been your experience in Cameroon, and what advice do you have for other countries?
Ce qu'il faut déjà dire, c'est que notre coordination a été placée à un très haut niveau. Nous avons toute une structure, maintenant ancrée au premier ministère, qui veille notamment à la mobilisation des fonds pour pouvoir couvrir les gaps que nous avons dans notre pays. Et il y a également eu l'élaboration d'un plan de plaidoyer visant la mobilisation de tous les secteurs contributifs éventuels, secteur public, donc tous les autres ministères, qui pourraient avoir des actions à mener en faveur de la lutte contre le paludisme, le secteur privé, les collectivités territoriales décentralisées, donc les mairies, les parlementaires. Eh bien, tout ce beau monde a été enrôlé dans le cadre un grand plan de plaidoyer national qui commence à être mis en œuvre. D'ailleurs, il commence dès demain avec un grand lancement d'une campagne Stop Malaria sous le parrainage de la première dame du Cameroun, qui sera lancée demain en présence de tout un parterre de membres du gouvernement, du secteur public, des grands patrons d'entreprises du secteur privé et de tous les autres pris en compte dans le cadre de ce plan de plaidoyer. Donc il y a ces deux actions majeures qui nous permettent aujourd'hui de dire que nous sommes véritablement lancés dans cette importante activité de mobiliser tout le monde, tous les secteurs en faveur de la lutte contre le paludisme. Alors, le conseil à donner à d'autres pays, c'est simplement d'abord hisser la cause du paludisme au plus haut niveau. Si on peut arriver jusqu'à la présidence de la République, ce serait bien. Mais déjà, le plus haut niveau où on y serait, cette lutte-là fera du bien à la lutte contre le paludisme dans nos pays en Afrique.
Thank you. Dr. Emable, Rwanda is one of the countries using innovation, such as drones, to fight malaria. Last year, the first malaria vaccine was approved by the World Health Organization. So if you can tell us, in what other areas do we need innovation to end malaria on the continent?
Yeah, innovation are very very key to address challenges of malaria. Typical examples include the current change in mosquito biting behavior. When we keep using bed nets and spraying, those prevention interventions are all indoors and are waiting for adult mosquitoes to come in our houses. But now mosquitoes are changing and biting outside, and we documented that through data use and surveillance, we can detect that mosquitoes now can bite people outside and they are not protected. And one of the innovation was to use data for decision making or to design strategies. And currently, we are working with the different partners to ensure that we deploy additional or supplementary interventions where mosquitoes are biting outside, how we can control them outside, either using a mosquito repellent product, either implementing integrated vector management, where people are informed on how to manage the environment to remove all breeding sites outside. This is one of the innovation of using data for decision making, but also we need more than that. It's where you mentioned that we are using drones for live sighting because reports from the program show that where we have the high incidence of malaria, it is where we also have water bodies, mainly rice plantation areas or mining activities or other farming activities. And these areas need more than IRS, they need more than bednet. And using innovation, we are now training local communities, mainly community health workers, but also local leaders themselves. And using local NGOs, we are training those people, local communities, on how to manage those breeding sites manually. Where they can't reach, they are now using drones. This is another area people may explore to see how we can supplement existing core interventions, which are basically indoors, leaving out those mosquitoes outside, or even not targeting those early stages of mosquitoes, larvae, because all adult mosquitoes are coming from those larvae. And when you wait for adult mosquitoes, we are leaving that gap and better meeting our enemy at the early stage outside of our houses before they reach us. I think we have many areas of innovation, but very key is deploying interventions based on data, based on evidence, but also innovation through cross-sector collaboration, because the Ministry of Health itself is not able to address malaria concern. Currently, we are involving Ministry of Agriculture, Ministry of Education, local government, local NGOs to ensure that they all engage in malaria control where they live.
Also on our panel today, Ms. Tandile Kumalo, Chair of the End Malaria Fund from Eswatini Board. Ms. Tandile Kumalo is the Chief Executive Officer of Sanlam Investment Management Swaziland. She is an entrepreneur and specialist in the field of business development and stakeholder management. She's a stakeholder employee at Daylight Fund Management, a company she co-founded, which is one of the shareholders of SIM Swaziland. Tandile is the visionary behind the registration of the first infrastructure fund in Swaziland, Yekuchalo Infrastructure Fund, which is a product of SIM Swaziland. Prior to SIM Swaziland, she worked as director of Daylight Capital on a number of major financial services and empowerment assignments in South Africa, where she had been based from 1997 to 2011. Tandile has a law degree with honors from the London School of Economics. She is admitted as a barrister at Law of Lincoln's Inn. She is also an admitted attorney of the High Court of Swaziland. She practiced as a lawyer in Swaziland with Millen in Curie for 2.5 years before proceeding to Cape Town to obtain a Master of Business Administration degree from the University of Cape Town. Tandile, thanks so much for joining us. I would like to ask you about your role as the chair of the board of directors of Eswatini's End Malaria Fund. Across Africa, End Malaria Councils have been established to elevate malaria up the political agenda of governments and private sector, mobilize resources, and drive forward tangible action. How has the Swatini's End Malaria Fund supported the country's fight against malaria?
End malaria funds have been very instrumental in the countries in which they've been established in working with government to fight the scourge of malaria. We've been working with the private sector and getting the private sector to partner with the national malaria programs that governments have set up by providing resources to enhance awareness of the scourge, as well as to make sure that we provide resources that will provide the money or the capital needed to pay for the various resources needed to fight malaria. So for example, in Eswatini, we've provided money to fight and pay for people who are going to spray homes. We've provided money that's been used for billboards and campaigns to raise awareness. We've also got in-kind contributions, so it hasn't just been money. We've been able to get entities like MTN to provide us with data, and especially for disease notification. We've been able to spend some money on buying drugs, such as Primaquine, to make sure that there isn't an infection. We've been working with the chiefs to drive the message in the communities about the scourge of malaria. So it's very important for the private sector and everybody who works together in the private sector to understand what the logo is of zero malaria. Starts with me, it starts with you, it starts with all of us.
One last question for all of our panelists. As we look towards Kigali CHOGM Summit, how can this summit and the Commonwealth more broadly help advance the malaria fight across Africa?
Well, thank you. I think this upcoming Malaria NTD Summit is itself an opportunity of having all expert investors, all stakeholders coming together to discuss the current situation of malaria and NTDs across the globe, but also discuss challenges and propose solutions, and taking the same opportunity to advocate for resource mobilization. Considering the design of the Malaria NTD Summit, and considering the participant, there is a hope that for different segments of the event, we have a high-level segment where head of state, head of government, different partners, investors will be calling for action so that based on the gaps identified, based on the current challenges, including COVID-19 pandemics and any other emerging pandemics, all partners or stakeholders can invest more in malaria NTD control. And I think to be also an opportunity to rethink, considering where we are now vis-a-vis global target for malaria control, but also considering the new roadmap for NTD control 2020-2030. I think we need also to present or discuss with all participants what is needed to reach there. Otherwise, if we don't play our roles, we may not expect to reach our target. And I hope having Malaria and NTD Summit in parallel or the same time with CHOGM, I think people attending Malaria and NTD Summit, some of them may be attending, mainly those investors or head of state and government will be attending CHOGM. I think there should be a link between those two events so that during CHOGM, as you may check and go back and see what was the CHOGM 2018 in London, what were the commitment to halve malaria by 2023? Where are we as a member state? What is needed? I think coming from Malaria NTD Summit may be helpful to link with CHOGM, and maybe from CHOGM resolution, I think we may see new commitment, new visions, and probably revisiting the target if needed. But if we keep the same target, we may need more effort, and this should be discussed, in my opinion, during both Malaria NTD Summit and CHOGM. Lastly, I think we need also to think of integration. Not only those two block the diseases are affecting almost the same areas of the globe, but also sometimes they may share the same risk. Mainly like schistosomiasis and malaria are really connected because people who get schistosomiasis are mainly working in those water bodies where they're exposed, but at the same time, the same water bodies are the one producing those mosquitoes. I think we can also see how we can integrate some services for efficiency, but also reaching our risk group because they are almost similar.
The CHOGM, the Commonwealth Heads of Government Summit, which was delayed by 2 years. However, we're really looking forward to organizing this in supporting Rwanda, which is the chair for CHOGM 2022, in organizing this extremely important Commonwealth Heads of Government meeting. When the heads come together and ministers come together and we are able to focus on several key initiatives and programs in order to ensure that we are on track for delivering on some of the targets. In this case, we are talking about halving malaria by 2023 in our Commonwealth member countries, and also looking at the journey toward ending malaria by 2030. Therefore, it is important for the Commonwealth to commit to ending malaria in the longer term and increasing investment in malaria programming, better targeting of at-risk populations, and a continued focus on ensuring services reach the poorest and the most marginalized. This is where the Commonwealth Tracker will continue to play an important role by providing data, but at the same time, CHOGM is important where we bring together all partners, all relevant member countries at the highest level to look at these options and look ahead toward how we can keep on track to achieve the goal to halving malaria by 2023, but also looking at the goal to end malaria by 2030. In this journey, we have been partnering very closely with several partners. As mentioned, Malaria No More. The work of ALMA is also extremely important, and we've recently signed the MOU with WHO. And in that, initiatives like the high burden to high impact of WHO and RBM partnership is one of those initiatives which, together with the recent MOU that the Commonwealth Secretariat signed with WHO, the Commonwealth will work to support and accelerate progress and in helping Commonwealth countries to get back on track to achieve our common goal to halve malaria by 2023 and toward achieving the target of eradicating malaria by 2030, if not before.
De notre point de vue, ces grands événements qui rassemblent les plus grands du monde peuvent permettre d'adresser tous les gaps des plans stratégiques que nous avons dans nos pays. Vous savez, dans la plupart de nos pays, nos plans stratégiques sont budgétisés, mais nous avons beaucoup de peine à couvrir ces budgets à partir des fonds domestiques, même avec l'appui des partenaires, avec le niveau de coopération que nous avons actuellement. Donc, ces grands regroupements sont véritablement des endroits où on peut aider la cause du paludisme en Afrique, notamment en venant en appui pour la mobilisation d'autres bailleurs de fonds et des leaders pour des financements additionnels à nos plans stratégiques pour que la lutte soit menée convenablement. Alors cet appui peut également revêtir le sens d'aider à la couverture des interventions qui ne sont pas encore mises en œuvre. Chez nous, on a par exemple la fluorisation intradomiciliaire qui n'a pas encore pu être mise en œuvre à cause des déficits de financement. Il y a des secteurs entiers comme la formation des prestataires aux directives et d'autres interventions. Donc, c'est vraiment pour nous des milieux où la plupart des dirigeants peuvent aider à rallier des bailleurs de fonds ou des financements additionnels pour couvrir nos besoins, les besoins qui restent à couvrir dans nos plans stratégiques.
Thanks so much to our esteemed panelists for this very important conversation. Dr. Imable, please stay with us. You're about to show us a film. Would you mind introducing it for us?
Yeah, thank you. Recently, the Rwanda Ministry of Health Malaria Program, in collaboration with ALMA, with their financial support, we have been working on producing a kind of success story from Rwanda in response to both malaria and NTDs, with a focus mainly on the impact of key interventions to control malaria, but also looking at how we are using scorecards introduced recently in Rwanda with support from ALMA. The scorecard helping different levels, starting from central level up to district level, monitor the impact of interventions, but also assessing where different levels are in responding to both malaria and NTDs, but also using the same indicators on the scorecard to deploy specific interventions where needed. Basically, the content of the video is about this, showing the success stories in Rwanda regarding malaria control, how interventions being implemented are giving good results, but also how the use of scorecard is helping different levels for accountability, but also for monitoring the impact of interventions so that we can design strategies where needed.
Rwanda's journey towards malaria elimination has not been easy. In 2016, Rwanda saw a huge upsurge with over 5 million cases across the country. But with the help of the Rwandan government's malaria contingency plan, the country has been able to get back on track for their target of elimination.
In the last 4 years, Rwanda Malaria Program have been using mosquito-resistant data and malaria incidence data to mobilize domestic and external funds and guiding effective malaria control intervention deployment countrywide.
The interventions laid out in the plan have helped manage and reduce malaria cases countrywide and start in the homes of people across Rwanda.
These strategies include prevention. We distributed bednet to all people. In addition, we introduced sustained indoor resistant spraying, and currently we are spraying in at least 12 districts of Rwanda, where we have 75% of the national malaria burden coming from those 12 districts.
With sustained interventions, Rwanda has seen a drop in malaria cases of around 63% since 2016. This has been enabled by the rollout of 60,000 community health workers that are able to treat uncomplicated cases of malaria and provide referrals to patients when necessary.
Araza ubwo akambwira nkurikije ibyo ambwiye ubwo mfata umwanzuro wo kumuvura ubwo n'uvuga iyo nsanze iyo mbonye umwana nta malaria afite kandi agaragaza ibimenyetso mpita mwandikira transfer nkamwohereza ku kigo nderabuzima kugira ngo bamufashe kuko nubwo twebwe dusuzuma malaria nta yindi miti dutanga.
Partnerships have been key to success in Rwanda, such as the government's work with Charis, who have used innovation to facilitate elimination in the most high-burden, hard-to-reach areas.
We map areas where we identified breeding sites for mosquitoes, and then we deploy drones to spray larvicide in those areas, killing the mosquitoes at a really early stage.
All of these interventions have been informed by the use of the malaria scorecard. By tracking the progress of districts across Rwanda, the government can promote accountability and prioritize action where it's needed most.
Using scorecard for home-based management help us to focus target supervision by different partners and the control in the central level to increase the coverage or access and for us to achieve targets.
Using all these interventions in tandem has allowed Rwanda to turn the tide on the malaria epidemic and change the lives of people across the country.
Rwanda's progress in malaria is indeed a success story because Rwanda has got a vision to have a country free of malaria. Zero malaria starts with me.
Kurandura malaria bihera kuri ji. Zero malaria starts with me.
Kurandura malaria bihera kuri ji.
Zero malaria starts with me.
Thank you so much to you all for attending today's webinar. I would also like to thank our esteemed panelists as well as the team from the ALMA Scorecard Hub for organizing today's webinar. As you may remember, last month we launched the ALMA Scorecard Hub Maturity Tool, an innovative new tool designed to support countries improve the use of their scorecard for action and accountability. We'd like to encourage all countries to complete a short self-assessment. It only takes 10 minutes, and it allows you to access curated recommendations and access technical assistance from ALMA. We will also be hosting our next webinar in April for World Malaria Day. And if you haven't yet subscribed to our newsletter, please do so to keep in touch with us. Thank you so much, and see you next time.